Hello, guys. I would like firstly to welcome every one of you. I would mention your names: Dr. Afra, Dr. Aaron, Dr. Bisher, Dr. Daniel. Hopefully, I'm not pronouncing any name the wrong way. Dr. Hinal, Dr. Camelo, Dr. Khan, Dr. Krupa, Dr. Milad, Dr. Monica, Dr. Rachel, Dr. Yusuf, and Dr. Ishika. Hello to everyone. Welcome to everyone. You are welcome in our group. You are welcome in this preparation course for ADC written examination. I have very important notes regarding, before we start our class, I have very important notes to firstly introduce, and you need to understand this very well. The first point or the first note that you should ask and clear your doubts when needed, and don't ever go to the exams with your doubts. After the exam, usually I find some people, they tell me, okay, we had a doubt regarding this question, we had some doubts regarding those ones, and unfortunately, they went to the exam with these doubts. This is not really appreciated. You have a doubt, you can ask me. You can send me a message to the messenger. Okay, you have my WhatsApp. You can send me to my WhatsApp privately. I prefer that you do this privately. Okay, in order not to confuse the other people. If you have a personal question, it's better to ask me privately, not in the group. Okay, in order to prevent confusion of other people. Also, the second point, that you should not be double-minded and get confused with more than one mentor or different point of views. You know that there are many different mentors nowadays. There are different points of views, so it's not really recommended that you get confused with so many um, points of views. So I believe it's better for you to pass this exam that you trust just a single mentor for the exam. This would make you more focused rather than to be feeling like this or that, or maybe the third answer may be the correct one. If you have any doubt, just discuss it with me. Okay, I'm open-minded. I'm not going to block you because you give a different answer or a different opinion from mine. You may be wrong sometimes, you may be right sometimes, so it's all right. I'm all open-minded to understand your opinions, understand your discussions. The exam is very serious. ADC staff don't care if you have financial, family, or even medical conditions. So when you study, you must give 100% of your energy preparing for the exam. Remember, and I would keep reminding you, there are no excuses. I was busy with my personal stuff. I had some emergency. I had some urgent issue. ADC don't care about what you have, about your personal lives. And this is something unfortunate. But anyway, you are submitting yourself to their policy, so you have to understand how they work. I remember in my clinical exam in 2015, I just mentioned before the examiner that I'm feeling a bit stressed, and he just looked at me and he was like, "What are you saying?" They don't care if you are stressed, okay? You have to understand this because they understand when you are a dentist and as a human, of course you would have some stressors in your life. So how would you deal with this kind of stressors while you are working as a dental professional? So don't ever tell the examiner or work under stress, or even tell the examiners that you have some stress, or because of your stress you failed the exam. They don't care. This is a feedback from one, of course, I received some feedbacks from people who passed and who failed the exam. This is a feedback from one of the candidates who failed the exam in last March as just an example. In the last exam, that was my fault, didn't take it seriously. You were very good in all stages and supportive as well. I just promised myself not to repeat that behavior again. I'm just giving an example. So the exam is very serious. I'm doing my best. There is a big rule, which is yours. Although failing the ADC exam is not the end of life, but usually people get stuck and disappointed when they experience failure, especially with the tough journey of ADC. There is much time is given, effort, money. So the point is you must take the matter of studying for ADC is currently your first priority and before any of your personal interests. So study, study, study very smartly in a hard way. I understand that it's very tough. I understand that we have personal points of views, personal issues, personal problems, but ADC don't care. Remember this point. At any stage, you will be most likely affected by the behavior rather than the talks or even the skills of your mentor. Your behavior is important. If your mentor is not professional and disparage or discredit his or her colleagues, you will unfortunately behave unprofessionally with people, either they are patients or even your colleagues. This is an example of the very professional questions of the new pattern past exams. This was an SPQ, which is abbreviation of scenario-based question. So you examined a patient and advised him that endodontically treated teeth usually need to be covered by a crown once the endo treatment is done. The patient becomes frustrated as the other dentist did not advise him of the same. You explain to the patient that root canal treated teeth should have crowns placed as final restorations to avoid fracture or damage to the supporting structure or the crowns. The patient did not know that information of the previous dentist, or if the previous dentist placed the proper treatment crowns that could save the root canal treated teeth. So now the crowns are fractures and there are radiolucences on the furcation areas on the IOPA, and the fractured crown clinically is up to the gingival 1/3. So what are you going to tell the patient? The first option, collect the records from the previous dentist with the patient consent and review the history of and the procedures. Many people opted for this option previously, especially in the first two exams. This option is not bad, however, it's not the one which ADC wants. Let the patient go back to his dentist and ask for explanation. You need to understand the question, okay? You need to understand the question. You might find 2 or 3 correct answers. However, one of them is extremely wanted by the ADC, and you have to understand this. So the second option, let the patient go back to the dentist and ask for explanation, raise a concern to Australian Dental Association, raise a complaint to APRA. Remember, being professional is very, very important in Australia. Just forget about the background you came from. Wherever you came from, whatever your country, just forget about your original country. You want to work as a dentist in Australia, so you have to submit yourself to their standards and their guidelines. So one of their standards, to be professional with your colleagues. Again, I'm going to repeat this point. If I'm telling you Please be professional with your colleague. However, I as a mentor, I'm just teaching you that the other mentors are really very bad mentors, right? I may have just some right point. You know what? When you are living in Australia and you are dealing like this, you are violating the Australian law. You cannot do this. You should never do this. You can't tell your patient that the other dentist made a big mistake. He shouldn't or she shouldn't do this to you. This is a fatal mistake. Don't ever do this. You don't know what happened with this dentist, what happened with this patient. Moreover, the patient may be lying, who knows? Okay? So don't tell the patient, okay, you want to make the patient comfortable and like your work, like your treatment plan, and you just tell the patient, okay, I'm going to call my previous dentist, my colleague, and collect the records from this dentist, and you just need to sign the consent to review the history and the procedures. Don't ever do this. The best option ever that you should let the patient go back to the dentist and ask for explanation. Okay? There is another scenario. Suppose this patient insisting not to go back. So remember, the best option that you tell the patient, please, you need to go back to your previous dentist because I don't have enough information about what happened with you regarding your treatment, so I cannot say anything positive or negative. Okay? Otherwise, if the patient is still insisting in this very condition, you would tell the patient, and you would opt for option A. You tell the patient, okay, I'm obliged now, upon your request, that you sign a consent in which you are inquiring that I collect the records from the previous dentist, and you can proceed with your treatment plan. Okay, so remember always to be professional. Also, there is one more important point. ADC is after not just your right or the colleague's right, but mostly the patient rights. This is one of the most important points. Some of the candidates who passed the last March exam, he asked me a question, and it was about this question: if they are having the patient at their priority. I mean the medical system in Australia. So yes, you would find that the medical system is after the patient rights. Okay, so sometimes you have to give the priority to your patient. Of course, not in all conditions, but this is considered a priority. We would have different situations, different conditions, different questions in which we would discuss these different scenarios. So if the patient is not satisfied with dental professional, encourage the patient to speak to the dental practice or the dental professional providing the treatment. Generally speaking, don't allow anyone to oppress you to pass an exam. Don't pass your exam under oppression. This would be a mindset. Okay? You would find yourself oppressed in every situation, even after you pass the full process of ADC. After even you are registered with the opera, you will get yourself oppressed by different people. So don't allow this. Nobody can lead you to success other than God's grace. This is my personal belief, and your hard, serious work. Okay? So you have to work very hardly. So I am, as a mentor, enlightening your pathway, but you still have the biggest role. I'm not the one who is giving success. Okay? I'm enlightening your way. It doesn't matter if you appear for the first time or the seventh time, provided you listen carefully to my advices. Don't insist on what's wrong. regarding answers as long as they are well explained. Still, if you have a doubt, feel free to ask me and don't ever hesitate. Again, don't go with your doubts to the exam. We will be having a mock test every 2 classes just to make short, sharp shock to keep you on the track. Somebody would ask me, but um, after 2 classes or the first 2 classes, we just finished very, very few chapters or very few study materials. So for sure, we might be failing this mock test. I agree with you. However, still, this is considered short, sharp shock that you would be able to, pardon, you would be able to understand where you are lagging. This is what's called short, sharp shock. The study plan should be parallel in your study with your classes, with our classes. TG must be well studied for at least 5 times before your exam. Past exams must be well understood. Memorizing only nowadays is not recommended because it's not the same way as it was before September 2021. There is a new pattern. So if you just study like memorizing, I believe most of people who are memorizing the questions would fail or already failed the exam in the new pattern. So don't depend on memorizing. Understand the Australian basics. Also, infection control guidelines should be well digested, repeated at least 3 times. There are many questions about infection control. They are focusing on ADA articles. That's why I chose these articles to be the very first beginning of our classes. So topics like mouth guards, there was a scenario about mouth guards, like not just one scenario, it was 2 scenarios in last March exam about mouth guards. So the full information about this is given on the ADA website, the fact sheets. Don't take the fact sheets lightly. There are answers for some questions in these fact sheets. So ADA articles are close to complete SPQs of the new pattern past exams. For people who appear for the first time, the exam is fully scenario-based questions. So you need to train yourself to professionally interpret the questions and the answers, as you might find pretty 2 or 3 correct options in different questions of the scenarios. So ADC wants a specific one. So they here test your understanding ability. Remember, guys, for people who appear for the first time, the exam is consisting of 4 clusters. In every cluster, there will be 70 questions. The full exam is scenario-based questions. There is no just MCQs like it was in the old system of the exam. So it's not anymore. So here some questions about how ADC is testing your understanding ability. A 45-year-old lady comes to your clinic. She's a regular attendee. She previously had endodontic treatment and crowns placed in 36, 37, 46. This is one of the questions of past March. She says she has pain after every appointment and she has to take painkiller. She hadn't disclosed this matter previously. The patient has to be given intradermal fillers, which is Botox for TMD. The patient who is nervous and has pain in her ear since 1 year. So this lady was visiting the dentist after quite a while, says she gets headache after dental sessions. She also says she has pain over the cheeks temple when she wakes up in the morning. This is a key word. Also reports that teeth 36, 37, 46, 47 endo treated in last 3 years. There was, as it's already mentioned, pain on the cheek's temple and extends towards the cheek. While obtaining the informed consent, what has to be considered regarding the Botox or botulinum botulinum toxin, what information you would give to the patient? We have one or more than one correct option here. The first option, the injection is experimental only. In other centers, there are some feedbacks that they are changing some questions or some options in different centers in the world because some, as you know, the first exam, or firstly, the exam is conducted in New Zealand because of the timing, and then after that, Australia, and after that, the other countries. So there is time difference. That's why ADC maybe in last few years, they intended to make some variation in the questions in order to avoid getting the questions leaked during the exam. So the injection is experimental only, or treatment has guaranteed long-term effects. Another option, only dentists can do Botox, or it may cause trismus. And finally, you have to consult a specialist. So for this question, you can go, some people opted for only dentists can do Botox, and this is correct. We have an article about this, that dentists can do the Botox. But this is not the answer which is really needed or wanted by ADC. They wanted to understand, if you understand that the use of Botox is just for, or it's the injection of Botox is for experimental uses. Okay, it's not totally proved by studies and researches that it would be beneficial for TMD. Okay, so although the third option, only dentists can do Botox, is correct. However, we would go for the injection experimental only. This is the most important point to mention to the patient. The patient doesn't care if it's the dentist who is going to do it or other medical professionals. This is not the point you need to tell the patient. So what you need to tell the patient before the patient sign a consent, that this injection is experimental only, which means it has temporary effect. Okay, because after like 3 months, the patient would come back and just tells you the pain is already present now after 3 months of your injection. What would you tell the patient at the moment? Because you didn't make the patient understand that this is a temporary effect of Botox. So it's very important to understand these points. The exam is about understanding. Don't ever just memorize. Example 2. William is an 8 years old child. Come with his father 30 minutes after avulsion. There is a case of avulsion tooth with tooth 11 and 52 lost during football injury, or thanks to football injury. Two avulsed teeth 1151, and they only found one tooth of these two teeth, and its upper front teeth fractured in the skull, fractured segments missing, and the authorities are looking for the missing two teeth, 12 and 52. The coach brought the missing teeth later. So what is the first thing you ask to the child or even to the coach? What's the first thing? What you are going to tell or ask the dad or the father of this patient? Because the question is about the father who brought in another SPQs about father, in some different SPQs it's about the mother who brought the child. So anyway, it doesn't matter, but there is somebody with the child. So what is your priority here? There is an accident, there is an injury. Of course, the avulsed tooth is very important to be replanted immediately or as soon as you can. However, this is not your priority now. The most important priority, that the patient did not lose consciousness. There might be head injury or neck injury. So don't focus on the dental injury only while you are managing a patient. This is what's management about. That's why some people are failing management. They focus on the dental management. You are a dental and at the same time is considered medical professional. I don't mean general medical professional, but in the scope of dentistry. So you are dealing in a general view of the human body, and more specifically, the orodental tissues. So it's important to understand if the patient, if the child, the boy, lost consciousness or not. There might be a head injury, as I mentioned. Of course, there may be some other options like when the tooth was avulsed, how it was avulsed. They give questions like this. But still, your first thing you ask about if the child lost consciousness. So you have a basic in your mind. The third example, your dental assistant was suggesting you skip ultrasonic cleaning. This question is about infection control. To skip the ultrasonic cleaning step as she was sure that sterilization procedure were done optimally. The other, this word, the other, not bother, the other sterilization procedures were done optimally. What is the one best explanation you can give to your dental assistant which would make a complete sense in the favor of using ultrasonic cleaning? So the options were washing instruments by hands can cause injury, and this is correct. Um, Ultrasonic cleaners remove organic masses which get stuck to the instruments, and this prevents steam penetration. The third option, ultrasonic cleaners are more efficient than manual cleaning. The data can be stored and monitored efficiently by the use of ultrasonics. When you answer this question, option A, which is correct, they understand that you don't understand. Again, you have to answer the specific question, not the question in general. Of course, you would find in the infection control guidelines that washing the instruments by hands, like the files, will cause injury or might cause injury. So it's not recommended. But the question here is about the favor of using ultrasonic cleaning. They ask about cleaning efficacy. So you have to answer ultrasonic is more efficient than manual cleaning. Both option A and C are given in the infection control guidelines. However, option C is um, is justified here because they ask about ultrasonic cleaning efficacy. The next note that your final goal is passing the exam. I did not at at the moment or till the moment I did not discuss our topic for today. I'm just giving some general rules and notes. Your final goal is passing the exam. However, your initial goal should be getting 4 A's in the exam. In other words, if you don't focus on getting the highest score in every cluster, the mission would be very tough. In other words, if you are studying to get, I just some I listen to some people or I see some messages of some people. They tell me, Peter, all what we need to have just to pass the exam. I understand this point, but this is your final goal. If you keep this mentality, I want to pass the exam, unfortunately, very few people can pass the exam according to this mentality. Very few people. I will not say that you will not pass, but I would say very few people. But if you kept in your mind the highest scores, the highest preparation for your exam, I believe you would at least pass the exam. This is important. This is very important. So again, your final goal is passing the exam. However, your initial goal should be getting 4 A's. We have two people who passed um, the last March exam, Dr. Fatima and Dr. Hani, and they were both got 4 A's. I remember Dr. Fatima, she told that her her goal was to get 4 A's and she worked on that. I remember she kept asking me privately to clear all her doubts, even a few days up before the exam. You must pay attention to every message I send to the groups. I could see that some of you asked me some questions just before the class. Please don't skip any of my messages. Take it very seriously. You are the one who I would keep, of course, motivating you, but this is not enough unless you motivate yourself, unless you think about your personal life, your career, your family. This is the real motivation. When you think about this, you will be motivated. So please, you must pay attention to every message I send to the groups I added you to. Also, we would have WhatsApp group for discussion. Most probably, I would add you, or I would make the group today. I will add you when you send me your phone numbers after I make the group, the WhatsApp group. Respect to all your colleagues and don't hide the information you have about specific question is highly appreciated from my side, and remember that you are all sailing in the same boat. Being selfish is not really preferred or considered. So please don't be selfish. Learning is unceasing process. So always humble yourself even if you are the only knowledgeable person on the earth. This is one of the clues to have values and morals in your life, to be humble. I myself, I have much knowledge. I can say that I studied like more than 35 textbooks in dentistry since 2014. I can say so many information about me. It doesn't matter. It doesn't matter. What matters that I know everything. I have knowledge. I mean, I have knowledge every day. I'm still lacking some information. I'm still learning. So once you have this mentality, I believe you can pass this exam easily, and also you would have this moral and this value all over your life. I think this was. I know it wasn't short presentation. However, it was important to mention these points. Okay, I didn't mention that we would have interacting classes. So our classes are not one-man show. So we will all interact in the discussions. I did the presentation at the very beginning. I just finished. However, there is some role from your side. So I would give the chance for every one of you to answer some questions. Please, everyone, open the class which I already sent, maybe a few days or 1 week ago. The unanswered session. Please, everyone, open this paper. I'm going to stop the sharing because I'm done with this. I want to test what you understand, what you read. Don't be shy, everyone. Just be open-minded and be ready to answer some questions. Hopefully everyone is ready. I'm going to randomly ask different people to answer these questions. I will start with Dr. Hussein. Hello, Dr. Hussein. Dr. Hussein, you need to unmute your mic, please. Dr.
Hi,
Hussein. Yes, now I can hear you. Hello.
Hello, Mr. Peter, Dr. Peter.
Hello, Dr. Hussein. Okay, if you would please start to answer the first two questions in our unanswered version of um, our class.
Sir, I need to open my VPN because of our internet issues in Iran.
Okay, okay, okay.
Let me ask another question.
No worries, no
Let
worries.
me answer.
Okay, I will
Sorry.
just mute you once again, and when you are ready, you can raise your hand. Okay, thank you.
Thank you.
Okay, Dr. Monica, hello.
Hello, Dr. Peter.
How are you?
I'm fine, thank you.
So you can answer the first two questions. So you studied laser, Dr. Monica?
No, not yet.
You didn't study the topic of lasers. This is one of the ADA topics, which I
Yes.
believe they didn't give a question, just one question before in the past exams, but I believe it may
Okay.
be a new topic for ADC in the coming exams. So that's why I decided to focus on that topic. So what is a suitable
Yes.
wavelength of laser to effectively remove dental decay? Can you just give an
Okay.
answer?
I suggest B.
Yeah, that's correct. It should be
Okay.
2,870 to 200
Okay.
2,090. I mean 950, right? So it should be
Okay.
option B. It's given. Sometimes they are giving like a similar value. They didn't give it like the typical value in ADA article, but they give some similar value. Okay, so you
Okay.
know the value.
Okay.
This also happened or occurred before in the previous exams in infection control. They asked about
Okay.
hepatitis B and they did not give the typical value, but they gave a range. So we need to understand the range and the value and be flexible with the options.
Okay.
So the next questions, question two.
Yeah. Okay. In patients with the use of laser in dentistry except. I think E, none of the above.
Why do you think that all of the followings are used in in dentistry, or they are all indications for laser in dentistry?
As a laser can remove tooth structure, tooth decay,
Yes,
and enhance healing process,
perfect.
and act as analgesic.
Okay.
Trans elimination, I don't know.
Yeah, when you
But I
read
think
this paper of laser, you will find this that's also laser can be used in transillumination. So removal of tooth
trans
structure,
elimination.
it
Okay.
enhances
Yeah.
healing process, and also it can be used as painkiller or analgesic. So none of the above, because the
Okay.
question is about all, and they finished with
Yes.
except. These kind of questions are given in many situations in the past exams, and you have to be careful when they mention except. What is the likely? What is the unlikely? You have to pay attention to this.
Okay.
The next question, Dr. Monica, I know you didn't read the laser. We need to take it very seriously, Dr. Monica, please.
Okay.
Yeah.
I will.
So, question three. You would answer the
Which
question anyway, even if you would give it incorrectly.
okay. Which
Yeah.
of the following types of laser is used in bleaching? I think argon laser or carbon dioxide laser. Argon.
Actually,
Diode.
yeah, argon exactly. Actually, option B, C, D, and E are not used in bleaching. Argon laser is used in bleaching.
Okay.
Thank you, Dr. Monica, for your
Thank you.
interaction.
Thank you, Dr. Peter.
All your interaction would be appreciated.
Thank you.
One. Dr. Yusuf, hello. Dr. Yusuf, are you there? You need to unmute yourself. You need to do this by yourself.
Yeah, I'm okay. Hi, Dr. Peter. Hi, everyone.
I'm good, thank you.
First of all, I don't know which PDF are you reading right now? I'm looking for that. Can you show us, please? Which questions?
I'm going to refer to this in the messenger group. I usually close the messenger because the messages would be confusing at that time. So I'm opening the messenger. I understand that some of you joined me lately, so that's why they don't find the okay, this one. I will mute you for now, Dr. Yusuf, and you can open it, and I will give you the chance once again. Okay, thanks. Dr. George. Hello, George.
Hello.
Hello. How are
Hello.
you? Yes, I can hear you.
Yeah, I'm fine.
Okay. So the next question, you opened the PDF I sent, George, right?
Yeah, right.
Okay. So the first question about body modification. Can you just proceed with the first question?
Okay. It says all the following body modifications are not allowed in Australia except uh, I think it's B, teeth sharpening.
Actually, tongue splitting, teeth sharpening, lip piercing, cheek piercing are considered illegal when they are done or conducted by any other body other than dentists. So it's legal to do tongue splitting, teeth sharpening, lip piercing, cheek piercing in Australia. It's legal. However, it's not preferred, and you should discourage this practice. Okay. So it's not illegal. However, you should discourage it. So the question here is about if allowed, which means legal or illegal. That's why we need to understand the question very carefully. So I can say very clearly that none of the above.
Okay.
Yes. You can proceed with the next one.
Okay, it's a 15 years old female presented with her mother asking for tongue piercing, as some of her classmates have the same. So the mother is very concerned in this regards, as this may result in infection. What would you tell the mother? So I will go for B, and it's for discouragement.
Yes, exactly. So the question here asks the mom if the piercing place uses sterilized instruments, advise her to wait till she is an adult, send her to a surgeon who can manage with possible complications, prescribe her antibiotic before the surgery, tell her tongue piercing can be uncomfortable, go ahead with piercing. So as you mentioned, and as we mentioned, that we should discourage her from tongue piercings. You can find this very clearly in the ADA article regarding body modification. Yes, the last question regarding body modification, Dr. George.
Okay, all the following can be significant local health risk of tongue piercing, except um, I think D, gum recession. can cause infection, swelling, bleeding.
The question is about tongue piercing, right? And they ended the
Yes,
question with the word except. So what
except,
is the
yeah.
relationship between tongue piercing and chipped teeth?
Oh, yeah, I'm sorry.
This is ADC.
Yeah,
This is how they
okay.
trap people. Yeah, this is the truth. This is how they trap people. You would find many questions in the past exams like this. No relationship between chipped teeth and tongue piercing. Of course, tongue piercing can result in infection. The tongue may be
Yeah.
swollen after this surgical procedure. There might be bleeding. They might result in gum recession. These are all mentioned in the ADA articles regarding body modification. But chipped teeth has no role here, right?
Mm. Yeah.
Okay, we will have just 10 minutes break and we will come back again. Okay, guys, let's proceed with our questions. Hello, Dr. Afra. Afra, are you there? If you are you there, please unmute your mic. Dr. Ahmed Kamal, hello.
Hello, Dr. Peter.
Hello, Dr. Ahmed. How are you?
Hello, Dr. Peter. Fine, thanks.
Yeah, so the next question regarding monkeypox. Monkeypox is a new topic. A new information is given in late 2022 about monkeypox on ADA site. So I believe maybe in coming exams, there may be some questions about monkeypox. So the first question is about when the monkeypox is being infectious.
And the monkeypox being infectious during the prodromal stage, number 3.
During prodromal stage or post-prodromal? I like your answer, by the way.
During, 1 minute, please.
Post means prodromal stage is over, right?
Okay.
And during, it means during. That's why your answer is correct, right? Okay, so monkeypox is not highly infectious and requires close contact with the lesions, body fluids, respiratory droplets, and contaminated materials such as bedding. So monkeypox is infectious from the onset of prodrome until the vesicles have scabbed over.
Vesicles have scabbed.
Yeah, and scabs have fallen off. So your answer is correct. It should be during prodromal stage. Yes, Dr. Ahmed, you can proceed. Very good.
Number 2, a 30-year-old patient presented with severe pain in tooth 1/6. On examination, there was a large carious cavity, and the patient was not able to sleep for last few nights. The patient is keen to keep the tooth. What should he do? I would go for E, conduct the RCT using transmission-based precautions.
Okay, I like option E as well. Why do you think option E is the most correct one? Please explain your answer.
The patient is keen to keep the tooth. So the extraction is not an option.
Yes, good.
And the patient has monkeypox. So I would treat him under transmission-based precautions.
Because the patient is having monkeypox, so we would use transmission-based precautions. Yes, that's correct. And on the other hand, as you mentioned, that the patient is keen to keep the tooth. That's why we need to conduct RCT. I will not extract this tooth for the patient, right? Suppose this patient told you that he or she doesn't like using the rubber dam. What would you do?
Rubber dam
like
issue
he
is
feels
medical
like he is
legal
not
extraction.
He's not able to breathe effectively, and it's bothering his breathing. So what will you do?
If he insists on not using rubber dam, I think extraction is the only option.
Perfect.
Extraction the tooth is the only option.
Perfect. So simply you would tell the patient that's illegal not to use the rubber dam for RCT procedure. And now there is another option, which is one of the options of treatment plan, that to extract the tooth, right?
So extract the tooth. If not using the rubber dam.
Yeah. Suppose the patient is still insisting, after all this scenario, is still insisting that he wants to have his or her tooth root canal treated, and at the same time doesn't like the rubber dam. What would you do?
Refuse treating the patient.
Very good job. You made the whole scenario
Refuse.
easy for all of us. You made it in the very correct way, Dr. Ahmed. So always, guys, consider refusal of treatment for any patients is your last resort. We would have just specific conditions in which we have only one option, just to refuse the patient, to treat the patient, like in cases of domestic violence. In these specific conditions, we might oblige to refuse to treat the patient, or a patient who is dealing badly with yourself or with the dental staff. So these are specific, and they are considered rare conditions or situations in which we can refuse to treat the patient sometimes straight away. Okay, like patient who is insulting or doing very, very negative behavior, or sometimes is endangering your life and your dental stuff, so you cannot proceed with treating this patient. You cannot deal with this. So if the patient has presented to the clinic and a suspicion of infectious measles or chickenpox has been formed while reviewing the patient's presenting condition and medical history, staff should delay non-urgent treatment. Let me share this point. I'm just stopping the sharing in order not to show you the answer, because I want to understand where you are standing. That's why I'm stopping the sharing. So if the patient has presented to the clinic and a suspicion of infectious measles or chickenpox has been formed while reviewing the patient presenting condition and the medical history, the staff should delay any non-urgent treatment. So this is an emergency. Remember, a patient who needs RCT, or there is a diagnosis of irreversible pulpitis, this is an emergency. Okay, necrotic pulp has no pain and is not considered an emergency. Of course, it needs RCT, however, it's not considered an emergency. Okay, so staff should delay any non-urgent treatment until a doctor confirms that the patient is no longer infectious. If urgent treatment is required for a patient with a viral rash illness, the patient should be isolated from the other patient and staff, perform hand hygiene, wear a standard surgical mask when not being evaluated or treated, be instructed to cover their mouth, nose when coughing or sneezing. So in this situation, the situation in which you have to work on this patient, adopt transmission-based precautions, as you mentioned, Dr. Ahmed, which is about contact and droplet precautions, including but not limited to the use of fit-tested and fit-checked particulate filter respirator, like P2N95 respiratory mask. So you can revise page 98 of NHMRC guidelines 22 for further information. Also, avoid coming in contact close with the patient if not immune to measles and chicken pox. For the next question, Dr. Ahmed, question 3.
Human transmission of monkeypox can occur through direct contact with infectious rash, scabs, body fluids, close contact with lesions, vomities. I don't understand. C. Vomities. What is vomities?
Like a contaminated lining, you know, Fomite, contaminated linen.
Con-
Contaminated linen.
Contaminated linen.
Linen which is covering the bed, for instance.
Oh,
Okay.
okay.
I know.
Contact with
The word
particles.
looks weird, I understand. Yeah.
I would go for E, all of the above.
So human-to-human transmission of monkeypox can occur through direct contact with infectious rash, scabs, or body fluids,
Yes.
close contact with the lesion of the skin, including during sexual contact, fomites like contaminated linen, and contact with respiratory particles. That's why it's all of the above. Perfect. Yes, proceed with the last question, question 4.
Number 4.
You are doing a great job, by the way.
Thanks, Dr. Peter. The lesions of monkeypox appears as vesicles, blisters, macules, pustules. Number A, vesicles.
Okay, we have some
That's a light guess.
here. We have some explanation here.
Okay.
It's not A, although A looks correct, but it's not A. The lesion looks like the blisters in varicella, but larger. So they typically
blisters.
They typically start in the head and the neck region rather than centrally in most patients. Direct skin contact may lead to blisters at the site of the contact, which is skin spots or rash. Both vesicles and blisters, this is our main point here, both vesicles and blisters are considered correct options. Though vesicles are small blister, less than 5 mm in diameter. So it's mentioned clearly that in the paper that it's blisters. And also remember that vesicles are small blisters which is less than 5 mm in diameter. Thank you, Dr. Ahmed.
Thanks, Dr. Peter.
Dr. Ishika, hello, Dr. Ishika.
Hello, doctor.
How are you?
Good, doctor. How are you?
I'm good, thanks. So, our next question about mouth guards. Can you proceed with the questions of mouth guards?
You are invited to your neighborhood rugby club as part of oral health promotion. The rugby club consists of 14 to 15-year-old player team. First question is, what kind of mouth guard was the best for them? D, custom made by laminar.
Why you didn't go for option E, which is custom made trilaminar? First of all, I agree with your answer that it should be custom made by laminar.
Yes, doctor.
What's the point here? We have to have some reasoning, logical reasoning behind our answers. I will not ever say it's A, B, C, D, E. No, no, no. I need to clarify why and explain why it's option D.
Because A option is not correct. It's a stock mouth guard, and B is boil and bite mouth guard. These both are discarded. Not good because they are harmful for some reason. And
yeah, stock mouth guard or boil and bite mouth guard are not preferred. They are deteriorating very easily and they are not fitting the best way when compared to custom made mouth guard, right?
yes,
So that's why it's not A or B. But why not option E still?
I'm not very clear with this thing, doctor. I'm also not very clear. Sorry.
Perfect. Okay, so the mouth guard, according to the article of ADA, the mouth guard can be constructed. Let's see this question and this answer. So the mouth guard can be constructed of 2 layers of EVA, pressure laminated together. The base layer is 3 mm thick and the outer layer is 2 mm thick. Custom-made, professionally fitted mouth guards should be considered as a part of the children's sporting team uniform. This is the preferred kind or type of mouth guard in children, okay, or in teenagers. Maybe in other adults, we may use in this kind of sports like rugby, we may use trilaminar, custom-made trilaminar mouth guard. But in teenagers, it's preferable that we use or make custom-made bilaminar mouth guards. Okay, Dr. Ishika, please proceed with the next one.
Thank you. The mouth guard should be replaced every year when the color changes after dental treatment, when they play other contact sports, when they are torn, option E.
Okay, I would agree with when they are torn if they are adult mouth guards. But when it comes to teenagers, I don't agree with just when it's torn.
Then option A, every year.
Suppose the mouth guard is not torn still, and 1 year passed, still you would keep it? The patient jaws are maturing day after another, year after another.
Yes.
So how come the mouth guard would be fit after 1 year?
Yes.
So the mouse guard should be every year. Of course, option E can be correct, especially when it comes to adult or mouth guard for adults. But when it comes to the teenagers, we need to pay attention that it should be replaced regardless of being torn or not every year.
Yes.
So there are some points regarding how to care for your mouth guard or how to recommend the patient to, or what recommendations you would give to the patient about the mouth guard. Let me share also these recommendations. So you rinse the mouth guard in soap and warm, not hot water. Remember that hot water is deteriorating the property and the fitness of the mouth guard. After each use, allow it to air dry. Disinfect the mouth guard from time to time with a mouthwash. Keep the mouthwash in a well-ventilated plastic storage box when not in use. The box should have several holes in it. Don't leave the mouth guard in direct sunlight in a closed car or in the car's glove box. Heat can damage it. By the way, these recommendations also are applied for aligners regarding orthodontic treatments, which are used in orthodontic treatments. They also applied for the same. It has some similar material which deteriorate by heat or under the sunlight. Make sure your mouth guard is in good condition before each use. Ask your dentist to inspect your mouth guard at every dental checkup. This recommendation for adults, by the way, mostly. Replace the mouth guard if it's damaged. Replace a child's mouth guard every 12 to 18 months. This is the answer for our question. Even if it appears to be in a good condition. Growth and new teeth can alter the fit. Replace an adult's mouth guard after dental treatment or tooth loss, otherwise it should last for several years. So there is differences between giving a mouth guard for adult and a mouth guard for child. We need to read the question very carefully.
Yes.
Thank you, Dr.
So in this case, doctor, we go for option A.
Exactly. So the mouth guard here should be replaced every year. as it's very clear
Yeah.
that replace a child mouth guard every 12 to 18 months. Maybe in next time they would give it like 18 months. It's all right. Suppose they give it 2 years, still it's all right. Unless they give 1 year time, okay? So here it's important to focus on the time in which you are giving or replacing the mouth guard. The whole question here is about understanding that this patient is growing, the jaw is growing, the teeth are growing. So it's important to replace the current mouth guard with a new one every year. Thank you.
Thank you, doctor.
Hello, Dr. Aaron. Dr. Aaron?
Hello, Dr. Peter. How are you?
Oh, I'm good, thanks. You can proceed, Dr. Aaron, with the next question.
So the next question is about the same question that we discussed earlier. It's about a 45-year-old lady comes to your clinic. She's a regular attendee. She previously had endodontic treatment and crowns placed in 36, 37, 46, and 47. She has pain after every appointment, and she has to take painkiller. She had not disclosed this matter previously. The patient has to be given intradermal fillers, Botox for TMD. She is nervous and has pain in her ear since 1 year. She also says she has pain over cheeks, temple, and extends to the neck when she wakes up in the morning. Also reports that 36, 37, 46, 47 endo treated in last 3 years. While so the options are, the question is, while obtaining the informed consent, what has to be considered regarding botulinum toxin? What info you would give to the patient? So the options are, the injection is experimental only, treatment has guaranteed long-term effects, only dentist can do Botox, it may cause trismus, you have to consult a specialist. And as we discussed earlier, obviously the option is the injection is experimental only, or it has only temporary effects, as we are aware that Botox can only help in minimizing the pain, TMD pain, for up to 3 months, after which they usually will have to have another injection of Botox.
Yes, perfect.
But you did discuss about only dentists can do Botox, which I'm not sure, because I think even cosmetic surgeons can do Botox.
Yeah,
this
is a good point, Dr. Aaron. Yes, this is a good point.
Yeah.
So when I mentioned that, I would read right now what is about this point, the explanation. So let me share with you, because you have raised a very important point. So did I mean that dentist only can, we have this option, which was in the exam. Did I mean that other medical professionals cannot do this? This is not the point. Let's see.
Yes.
C is also correct, though the question asks about what to tell the patient, so it doesn't make sense to tell the patient that only the dentist can give Botox, not dental therapist or hygienist. So here it's not, it's about the dental stuff, not the dental therapist, not the dental hygienist. The dentist only can do this. So this is out of the scope of therapist or hygienist. That's why here the question is about dentists can do this, but not therapist or hygienist. See here, this is a quotation. Generally, dentists are prohibited from supplying restricted medicines for therapeutic use to others, including dental hygienists, dental therapists, or other oral health therapists, registered nurses, and unauthorized persons. where these people are not under the direct supervision of the dentist. Okay,
Yes,
so that's why
I agree.
dentists can do this, or only can do this, is considered a correct option. However, this is not the best one, but not in general term. Is this point clear, Dr. Aaron?
Yes, thank you, Dr. Peter.
Yeah. There is some evidence of the use of botulinum toxin to manage the symptoms of TMJ when conservative measures are inadequate. So ensure the patients understand that this kind of toxin is not a cure for TMD. That's why we mentioned, or the question already mentioned, experimental, but may be used as a part of overall management strategy. Okay.
Yes,
Can you please proceed with the next question, Doctor?
sure. A Filipino man migrated to Australia and on government money has a white lesion on the ventral surface of the tongue. The patient has a broken distolingual cusp of lower molar, a sharp edge. The patient is a gay and lives with his partner, have occasional habit of drinking and smoking. The first question is, he has a lesion on the tongue and also a broken tooth on that side. You fixed or smoothed it. When should you see him? The options are after 2 weeks, recall in 6 months, refer immediately for biopsy, when the ulcer is bleeding, when there is change in surface texture. I think it is option A, after 2 weeks, because if it's any other minor ulcer, they should heal, or even if it's a traumatic ulcer, it should heal after the causative
Factor is
causative
removed.
agent is removed. Yes.
Yes, perfect.
The other options, recall in 6 months, is too long and too risky. I wouldn't refer immediately for biopsy because, as I said, it might not be required if it's just a traumatic ulcer. When the ulcer is bleeding, yes, again, that's irrelevant, I suppose, at this, because of the kind of question or the symptoms that he's presenting with. Yes, it would be important if it's bleeding and if there's change in surface structure, texture after 2 weeks. If it's still present, yes, it is worrying. And then you refer to a specialist.
Perfect answer, Dr. Aaron. I have a question here. Suppose that the patient presented at your practice and the patient is complaining about persistent ulcer on the tongue now for 3 weeks, and you can find there is a fractured amalgam, there are sharp edges. What's your overall management of this patient?
So
I'm giving you
once
options.
again,
What would you do?
If it's next to the to the tooth that is causing,
it's next to the tooth. Yeah, that's the scenario.
Yes. So you obviously try to smoothen it or redo the filling and make the tooth smoother, and reevaluate that in 2 weeks' time to see whether the ulcer has healed. If it hasn't, then we definitely need to take a biopsy and refer him to a specialist.
Now I am obliged to give you some options. Okay, I'm giving you some options, like that you would just review the patient. You would just review the patient after 2 weeks' time. You will do nothing and review after 2 weeks' time. And the second option, you will smoothen this sharp edge and refill the tooth by amalgam, whatever the filling material you are going to give, and review after 2 weeks. Or the question is about management, not treatment. There is a tiny difference between management and treatment. Management is including treatment. Treatment is not including management. This is important. So management is including referral to a specialist, referral to a psychiatrist, referral to referral in general is one of the most important steps in some management or treatment plan. So, or management plan in general. So we have two options here, and the third one that you smoothen this sharp edges and you refer the patient immediately to a specialist or medical professional for a biopsy. Okay.
Yes.
Like, suppose you have these three options. What would you do? And why?
Again, I will assess his medical history first. Again, smoking and frequency of alcohol, and also
suppose the patient is not. Excuse me, Dr. Aaron. Suppose the patient is not smoking, is not drinking, and he or she is medically fit. Still, what's your management?
Referral to a specialist.
You would just refer to the specialist, or you smoothen the sharp edges, or both?
Well, I will smoothen the sharp edges, yes, first, and then referral to the specialist.
This is my point. Why you would refer this patient? First of all, you have something to do here locally. You need to smoothen this sharp edge. And if it's a traumatic ulcer, of course it would heal soon, right? And at the same time, your responsibility, your duty of care, that you refer this patient immediately. Because 3 weeks time is considered one of the red flag features according to TG.
Yes. Yes.
Let's read this from TG. It's important to make our quotations. TG is very, very important book. We have to revise this book so many times. So red flag features of oral mucosal disease, oral ulcers that have lasted for more than 2 weeks. Those ulcers, so these are the red flag features. Oral ulcers that recur, non-traumatic oral ulcer in children. So the first point was about oral ulcers that have lasted for more than 2 weeks. So I mentioned that this ulcer lasted for 3 weeks, right, Dr. Aaron?
3 weeks. Yes, yes, yes.
Pigmented lesions on the oral mucosa, red, white, or mixed red and white lesions on the oral mucosa of unknown origin, or with features of potentially malignant disease such as induration, ulceration with rolled margins, fixation to the underlying tissues, lesions in high-risk sites like the lateral side of the tongue, pardon, facial or oral paresthesia, especially when it comes to the parotid gland, for instance, persistent oral and mucosal discomfort with no obvious cause, lumps or swelling, including lymphadenopathy, swelling, pain, or blockage of salivary gland, suggestive of salivary gland disease. Okay. So when it comes to red flag features, these are the information, but when it comes to red flag features, as we mentioned, oral ulcers that have lasted for more than 2 weeks, oral ulcers that recur, non-traumatic oral ulcer in children, pigmented lesions on the oral mucosa, red, white, or mixed red and white lesions on the oral mucosa of unknown origin, induration, ulceration with rolled margin, fixation to the underlying lesions, tissues, lesion in high-risk sites, facial and oral paresthesia, persistent oral mucosal discomfort with no obvious lumps or swelling, including lymphadenopathy. Okay, you can proceed with the next question, Dr. Aaron.
Yes. Yes. So number 2, other than the sharp edge, what other factors is the contributing factors to the existing white lesion? So from the information that they have given, we can definitely strike off socioeconomic situation and gender. Alcohol, and there's definitely alcohol and smoking history. Oral cancer is usually seen in gay. That I have not heard of any documentation regarding that or any papers regarding that, but definitely alcohol and smoking history seems to be the right answer.
Perfect job. Unfortunately, in last March exam, some people answer this question like it's oral cancer can be seen or mostly seen in gays. Okay, so these kind of questions are considered a trap. So once you answer this question in this very incorrect way from the ADC point of view, unfortunately, this might speed your performance to fail the exam. So be careful about specific questions. If you fail to answer specific question, they might be happy to fail you because this is about their culture.
Yes.
Okay.
Yes.
So they are open to all cultures, and they are very sensitive and critical regarding these topics.
Yes.
So smoking and tobacco. This is one of the articles, and also this information is given not in details in TG, but here it's a bit given in details. Let me share the screen with you once again.
Yes.
As you can see, this is about oral cancer, how you are increasing your risk. This is considered a fact sheet, but it has important information. So the first thing about lifestyle factors that increase the risk of of oral cancer is smoking and tobacco. The second is drinking. Okay, drinking also, and when it comes together or in combination, alcohol and smoking, this would be very problematic regarding developing cancer. So oral sex, exposure and transmission of human papilloma virus through oral sex increases the risk of oral cancer, particularly oropharyngeal cancer. So if they give the option of oral sex, this would be a correct option. But if they talk about the relationship that these patients are gays, so it's a different story. If it's about gays, this is not the right answer. But when it comes to human papilloma virus, this might be a very correct answer. However, they did not give this option. So we have to specify and to be very, very critical regarding specific points and specific questions. Alcohol, smoking and tobacco, oral sex, and of course sun exposure. The skin on your lips is delicate and easily damaged by the sun exposure. There is a question in the past exams about actinic colitis, which is affected by exposure or predisposed by exposure to sun. So don't forget to protect your lips when you go out in the sun by applying a minimum of SPF 15 plus lip balm in order to avoid the harmful ultraviolet rays. Okay, please proceed with the next question, Dr. Aaron.
So the third question is, what is this red characteristic that signified the malignancy of this lesion? Sorry, I'm not able to understand the question.
What is the red? The red flag, you know?
Oh, red flag.
Yeah.
No, red flag is obviously the location.
Yes, because it's affected the lateral side of the tongue, right?
Yes, yes.
Yes, perfect.
Lateral side, floor of the mouth, and retromolar region
yes.
are more commonly, yeah.
And if you have the three,
num-
if you have the three sides, you would rather go for lateral side of the tongue.
Yes, yes.
Okay.
Question number 4, they asked what is the best biopsy technique? So I would think it would be incisional biopsy.
It should be incisional biopsy with white lesions or large lesions in general. It's preferable to go for incisional biopsy. Yes.
Yes, yes. The others are probably not relevant. What should alert you in his nodes? So I would say D if it's fixed to the underlying tissues.
So fixed is the same as indurated.
Yes.
Oh, yes.
Yes.
No, fixed. I mean, fixed means fixed to the underlying tissues. Indurated means hard. Okay. There is
Yes.
one of the red flag
Yes.
features, which is indurated. Indurated means hard. Yes.
Yes.
Thank you, Dr. Aaron, for your interaction.
Thank you. Thank you, Dr. Peter.
Next question with Dr. Devanshi. Hello, Devanshi.
Hello, Dr. Peter.
Yes.
So the question is, Emily, who is a 32 weeks pregnant lady, sorry, came for a general checkup. 2 to 4 had pulp necrosis. Patient had pain during pregnancy, and you decided to treat her. At supine position after reclining dental chair, she started feeling nausea, dizziness, headache, and fatigue. So what's the diagnosis? So she is pregnant, so most probably it might be the supine hypotensive syndrome, because this syndrome, I think this denotes that when the patient is in supine position, the uterus is compressed, which leads to the venous flow. The venous flow is not adequate, which leads to the hypotensive syndrome and like that.
So 30 weeks, 32 weeks pregnant lady. Which trimester is this pregnant woman? Or in which trimester?
It must be now.
Pardon?
It must be the 3rd trimester.
Okay, so this patient in 3rd trimester, right?
Yeah.
Suppose this patient is in the 1st trimester. What would be the right answer? Is it still supine hypotensive syndrome?
Not, there might be the vasovagal syncope, because due to the hormonal changes in 1st trimester, she might feel like she won't be able to eat much or that kind of things, and she might have these initial symptoms like nausea, dizziness, and headache in the 1st trimester as well. So.
Yes, perfect job. Thank you for answering this question. Because, you know, when you read the different articles, you would find that in 1st and 2nd trimester, we would consider this kind of reaction that the patient is having, or this patient is having vasovagal syncope. We can say it's supine hypotensive syndrome in the 3rd trimester. So what happens? Supine hypotensive syndrome, which is also referred to as inferior vena cava compression syndrome, is caused when the gravid uterus compresses the inferior vena cava when a pregnant woman is in the supine position, leading to decreased venous return centrally. So the point regarding this question, that the pregnant patient should be positioned on their left side, no supine or right side. So this syndrome is mainly affecting women in late pregnancy, which is 3rd trimester. Also remember, only urgent dental treatment should be conducted for pregnant women in the 1st trimester. Yes, you can proceed with the next question.
Second is, she comes to you for treatment in her 10th weeks of pregnancy, and when is the ideal time to carry out elective rectal treatment? So 1st trimester is not safe for any, like most of the dental treatments, because this is the stage of organogenesis for the fetus. So we prefer to delay any sort of treatment in first trimester, and I think as per I studied, second trimester is the safest period to carry out any elective treatment. So the answer
Yes.
would be C, 14 to 26 weeks.
Very good. So the ideal to carry elective dental treatment is to go for the second trimester. However, on the other hand, if the patient is having emergency like irreversible pulpitis, so you have to proceed with your treatment like RCT or sometimes extraction, even in the first trimester. Okay, and you can take X-rays if you are going to do RCT, so you can go for you take X-rays. It's not contraindicated, even from day one contraception. Yes,
Yeah.
proceed, please.
Yeah. So the next one is that the patient did not come earlier and then came back at 32 weeks. What's the most suitable or the safest painkiller because she's complaining of pain? So my answer is paracetamol because paracetamol has the safe guidelines to use for like even for the kids and for the pregnant women. But I won't go for definitely not for the codeine or celecoxib or any sort of non-steroidal anti-inflammatory drugs because it might have effect on the uterus. So the basic thing is just the paracetamol most of the time.
Yeah, because the question here, as you mentioned, it's about safest or most suitable. So it's preferably that we go for paracetamol. Okay. And once you do the extraction or you do the RCT, why should I prescribe some strong painkillers? It's paracetamol is not considered the strongest painkillers. However, it would work good after RCT and after extraction. And here it's
Because we are
considered the
removing.
safest one.
Yeah.
Yes?
Because we are already removed the cause of the pain, so it's just a like symptomatic treatment after
Yes,
the root canal.
that's correct.
Yeah.
Yes, question 4.
Yeah. Next one. Yeah. She asked how can she keep her baby's teeth healthy? What's your advice? So brush teeth. Just a moment. I'm just going through the options. Sorry. Um, So brush teeth twice daily with a pea-sized amount of 500 to 550 ppm fluoridated toothpaste at the age of 6 months. No, should be. I'm getting confused, Dr. Peter, about this question because I know after 6 months we use minimal fluoride, and after 6 years we actually give them like twice brushing and like some good amount of fluoridated toothpaste, but I'm not sure about the answer for this question.
So the right answer should be option C, brush teeth twice daily with a pear-sized amount of 500 to 550 ppm fluoridated toothpaste at age between 18 months and 6 years. All these guidelines, you would find them in TG and also in
Yeah.
ADE guidelines. Let me share the screen with you. Here are the whole guidelines regarding practical guidelines of use of fluoride. It's very important to memorize these guidelines. And let me tell you the truth that therapeutic guidelines is basically about memorizing. When I told you don't memorize, I meant don't memorize the past exam questions, not the other information like in TG. You need to repeat TG many times to be able to memorize the information given. For medical professionals in general and for dentists specifically, you would find that this TG is a sacred book of dentists in Australia. So it's important to read this book very carefully and hear about our condition here or our situation, that you read carefully the practical guidelines for the use of fluoride. Thank you, Dr. Divanshi.
Thank you.
Dr. Hassan, if you can proceed with the next question. Hopefully everything is working all right at your end. Okay, Dr. Hussein. Dr. Hussein, are you there?
Yes. Hello again.
Yeah, hello.
Dr. Peter.
Yeah. So the next question about sport
I
drinks.
finally managed to open the sport. Yeah. An 18-year-old boy complaining his front teeth edges getting sharper. He has asthma and has been an corticosteroid preventer and occasional salbutamol inhaler on exacerbation episodes. He prefer a vegetarian diet. He likes to exercise cycling and on weekends and plays football. Photo was given covering a labial aspect of two upper central incisor, shiny labial surface with slight thinning on incisal edges. Lateral incisor not completely shown and no much of erosion visible. The first question is, what is the cause of erosion? Uh, sport drink, because of the title of this question, sport drink, maybe.
Forget about the title.
Yeah,
What do you think?
because in the question, in the scenario, doesn't mention about the sport drink. I think a sport drink, the number 3 is correct.
Yeah, okay. So an 8 years old boy came complaining his front teeth edges getting sharper. He has asthma, has been corticosteroid, occasional salbutamol inhaler. He prefers vegetarian. He likes to exercise cycling on weekends and plays football. Yeah, there is some missing statement regarding sport drinks, but it's given in another SPQ.
Yeah.
So yeah, I understand that they didn't mention here, but actually in other SPQ, the same scenario is given, and this patient was having or was taking or drinking sport drinks. The most probable
Sport drink
cause of
is
the
erosion.
erosion should be sport drinks.
Yes. How do you prevent future erosion? Ask him to stop sport drinks. Number 2. We can ask him to replace sport drink with water. Number 6 is also correct.
So what do you think? It's option 2 or 6?
Wash mouth after inhaling. Consult GP, refer stress management. Number 6.
Yo, so it's better to keep this patient hydrated.
Yes.
Okay. The most important recommendation for a patient who is drinking sport drinks to keep this patient hydrated. So simply you cannot tell the patient needs energy. So don't tell him that you should stop sport drinks. He or she understands that they need this kind of energy or this kind of drinks. So you cannot tell, okay, don't drink these kind of drinks. But you have to give some logic option. So you ask him to replace sport drinks with water.
Exactly.
Okay? So water is the best option here to be replaced
The
with
best
sport
option,
drink.
the best replace. Yes.
Okay, there is another question which I remember now. it's a bit similar to this one. Okay, I'm going to share the same. So this patient, they ask about the same case. What half-time snack do you recommend for this patient? They give options like fresh apple slices, dark chocolate bar or squares, orange wedges, caramel bar, yogurt-based smoothies. So the same patient
apple
ask
slice.
about half-time snack. Yes, Dr. Hussein?
Apple slices would be great. I think so.
But it's acidic in nature. It would give energy, but still it has acidic nature.
Yes, but dark chocolate bar is sticky and can
Yes.
cause. And orange
Yes.
veggies is acidic, and caramel bar is sweet, and it can cause decays.
Yes.
Fresh apple slices is less cryogenic, I think so.
I don't think it's really cariogenic when it comes to fresh apple slices, but rather it's erosive as well. It has some acid.
Yeah.
There is some vinegar which is extracted from apple, so still it's acidic. It has acidic nature. So the right answer, that yogurt-based smoothies are perfect for reducing the acidity in your drink.
Oh, I
Yeah.
haven't seen that.
They are good.
Yeah.
They are good in let me say neutralizing the acidity of the mouth.
Yeah.
Because this is milk. It has milk. Yogurt is made basically from milk.
Yeah. I didn't see the E answer.
Yeah. Thank you, Dr. Hussein. Dr. Yusuf, you can proceed with the next question, please.
Yes, hi again. Dental
Hi.
trauma?
Yes.
Yeah. A 12 years old boy had an accident on 2021. He was treated in the oral and emergency department. They have done the re-implementation and stabilized it with a rigid splint on 11 and 21. Mother brought him for a dental visit after coming from ER. It was after 24 hours. Mother noticed that the 21 was placed a little bit longer than 11. PA is given with 21 still a little bit extruded. Mother washed it with water for 15 minutes and then placed it in milk. What would you do? A, immediate surgical repositioning of the 21 and change the splint to flexible. Digitally apply pressure to reposition the 21 and replace it with a flexible splint. Wait until it repositions by itself and observe reposition 21 and maintain the rigid splint. Probably C. I think C. Wait until it repositions by itself and observe. So if they already positioned it 24 hours ago, I'm not sure if we can surgically reposition that.
Why should we do surgical repositioning? There is no need for surgical repositioning, right?
Yeah. So they already positioned that.
So you just
So
need
I don't think we need the.
You need to digitally apply pressure to reposition tooth.
Digitally applied pressure means like a liner. Is it?
Yeah, you would apply flexible splint to keep the tooth in place.
Yes.
There is no need for surgical repositioning here.
That's right.
Okay, just digital pressure, and you give a flexible splint. Yes.
So the answer, the
Option
answer
B.
will be B.
Yes.
Surgical
repositioning is just in one condition if it's pretty intruded. Right. Also, the patient is, if the patient is if the patient is like maybe 6 years, 7 years old, so this patient is having an open apex, right? If the tooth is intruded, we would give a chance to the tooth to re-erupt once again. On the other hand, if the patient is having close apex, like a patient is 10 years, 11 years, so in this condition, we need to reposition the tooth.
Okay. So question number 2.
Yes.
What will you tell the mother regarding the home care of this child? A, chlorhexidine 0.2% mouthwash for 2 weeks. B, Na hypochlorite mouthwash. C, sodium bicarbonate mouthwash. D, hydrogen peroxide mouthwash. I think number A, chlorhexidine for 2 weeks. I'm not very sure, but I think that.
Yeah. What would you tell the mother regarding the home care of this child? It should be chlorhexidine 0.2 mouthwash for 2 weeks. That's correct. Regarding the previous question, okay, regarding the previous question, the case here is about a valsy tooth.
Yeah.
Okay? It's not about intruded. Intruded is a different story, as I mentioned. But here it's about a valsy tooth. It's already replaced in place. I mean, the reimplantation is already done, but there is some like a bit extruded. So there is no need for surgery. You just adjust it by your finger. Is it clear now? Dr. Yusuf, is it clear now?
Number 3.
No, I'm
yes,
talking about question 1. Because I felt that you don't get the point here. The question is about a valsy tooth, and it was reimplanted in the emergency department, and you found that it's still a bit extruded. You just need to do a digital pressure to adjust it.
Yes. Okay. So I was asking, can we do that after 24 hours? So you already answered yes.
Of course.
So we can apply pressure and do that after 20 hours.
Exactly.
Yes.
The tooth is not fixed already in 24 hours. It takes time to be totally fixed to the socket once again. Yeah.
Exactly.
But when it comes to an intruded tooth, what you consider that if the patient is having open apex, like when it comes to the central incisors, so 6 years old means open apex, and it's intruded, you just give a chance for the tooth to re-emerge once again. If the tooth is intruded and the patient is having close apex, of course, you will do surgical repositioning. Hopefully, these points are clear now.
Yeah, it is. Good, thanks. Number 3, what would be the management of this case? Commence RCT within 10 days or 2 weeks. Wait until there is a signs of discoloration. Observe until the child complains of any symptoms. Change the flexible and commence RCT within 2 weeks. I think C. Observe until the child complains of any symptoms.
This is a condition of a vaulted tooth which is reimplanted. You should
In that case, we need RCT.
You should change the
RCT
splint to flexible splint because we don't use rigid splinting nowadays according to the latest dental trauma guidelines. So first of all, you need to change the splint. Okay, and then you commence RCT within 10 days to 2 weeks time. It's very urgent to conduct RCT as soon as you can in the first 10 days to 2 weeks. These are the latest guidelines. There might be resulted in replacement resorption, ankylosis, this kind of resorption. And finally, the patient may lose the tooth, this child.
Yeah.
Proceed with the last question.
Number 4, what would be the factor which would interfere with the prognosis of the tooth? As the tooth was washed in the water for 15 minutes before placing it in milk, as it was placed in the milk, type of injury, time lapse between the accident and the tooth placement in the socket. Be the factor. D, time lapse between the accident and the tooth placement in the socket. I think this is the most important factor.
Yeah, as I mentioned before, you can find more than one correct answers, and you mentioned that option D is the most important. Of course, option D is very important, but here is not the most important. As the tooth was washed in water for 15 minutes. So once it washed for 15 minutes, it should be washed for no more than 1 minute. 15 minutes means killing of the periodontal ligament cells. Okay?
Yes.
So the patient should never wash the tooth under, even if the patient called you, like is informing what should the patient do with the tooth, you just tell the patient that he or she put it immediately in the milk. Don't wash it. Okay? So it should be the right answer that the tooth was washed under the water for 15 minutes before placing in milk. Because most probably that the tooth lost its periodontal cells vitality. Thank you, Dr. Yusuf, for your intervention.
Thank you.
Yes,
Thank you. So the question is asking about the bad thing they've done, right? Not the good thing. So they ask what would interfere. So that's make it difficult.
Yeah, exactly.
Difficult to hear.
So this is interfering with the prognosis of the tooth. That when you replace it in the socket, it might have good or bad prognosis. So the tooth have almost all its periodontal cells dead. So there is no use of placement of this tooth. Time lapse is considered the right answer, but it comes second after option A. So we can consider option D when we don't have option A. This is what ADC is doing nowadays. They understand that many people knew that this is the right answer, so they just substitute, they remove it, and they give you option D. So be familiar with having first and second option. First option here is A, second option should be D. Thank you, Dr. Yusuf, for your interaction.
Thank you. Thanks a lot.
Okay, guys, thank you very much for interacting. I want you all to be very interacting with me in the coming classes. Please don't keep silent, even if some people of you didn't have the chance to talk for any reason. So please make sure that you are all interacting, you are sharing what you know, what you studied. I encourage every one of you. Thank you very much. Have a good week in advance until see you next week.